In our final installment of our week-long series for Breast Cancer Awareness Month, Siouxland News anchor Katie Koppel takes us to the Nylen Cancer Center and sits down with the local doctor who's dedicated his career to advancing breast cancer treatment and research.
We have actually been involved in trials that have actually changed how we treat breast cancer patients.
The treatment for breast cancer has changed a lot over the years.
There's a study looking at a test of who we should give chemotherapy or who doesn't need chemotherapy.
There's been a shift in treating certain types of breast cancer, which has also led to a common misconception.
We're using less chemotherapy after surgery. So a lot of people think they're going to get chemotherapy and they don't.
Now, thanks to clinical trials and medical advancements, many types of breast cancers are being treated with more immunotherapies and less chemotherapies.
The most recent advance in there is with immunotherapy. We know that with chemotherapy and immunotherapy, we can get a lot of them get a complete response with chemotherapy before surgery.
Dr. Donald Wender is a physician at the Nylen Cancer Center in Sioux City. He's been working with breast cancer patients throughout his career and involved in some major advancements in breast care.
In fact, the way we standardly treat breast cancer patients, we were involved in most of those trials.
According to the State Health Registry of Iowa, over 14% of all new cancer diagnoses in Iowa this year are projected to be breast cancer, the largest percentage for any type of cancer statewide. And Sioux City is the lowest metropolitan area in Iowa with women aged 40 and up who have skipped getting a yearly mammogram. And looking at data from a 12-year study from 2004 to 2015, the risk of developing late-stage breast cancer is higher in the Sioux City area compared to the 12-year state average, which is why these new therapies and clinical trials are so important.
So there's not as many trials, but there are a bunch of trials looking at new approaches, and then, of course, trying to add immunotherapy.
The Nylen Cancer Center has played a big part in the advancement of breast cancer treatment. And while there aren't as many clinical trials as in the past, Dr. Wender says the ones that are available are working to answer even harder questions.
The clinical trials have slowed down because before we had a lot of big questions to answer. Do you give chemotherapy? What chemotherapy you give? Now we're trying to refine them down to new agents.
The treatment for breast cancer has come a long way, and the standard of care is constantly evolving, thanks to the dedicated work of physicians like Dr. Wender and the entire team at the Nylen Cancer Center.
Now, to see all 4 parts of Katie's series on breast cancer, you can visit SiouxlandNews.com.